Hello all. Today I'm going to cover some of the whys of headaches in concussions. First off, headaches can come from many sources, some serious. So it's especially important that you go to emergency if you experience other significant symptoms with your headaches. I'll give you some examples. Headaches with fever, chills, nausea, weight loss, neck stiffness, nighttime pain, and/or sweats. Another example are headaches with visual changes, tingling of the face, arms or hands, bowel or bladder incontinence, weakness on one side of the face or the body, and/or difficulty talking or walking. But as the saying goes, if in doubt, check it out, at very least with your GP or PMC. Believe it or not, there are 150 plus distinct headache types, but individuals with concussions are often diagnosed with having either post-traumatic headaches or headaches from the neck, also known as cervicogenic headaches. To have traumatic headache, it has to have resulted from a TBI and/or from whiplash. It has to have come on within 7 days of the accident or after regaining consciousness. It can include any pre-injury diagnosed headache type, for example, a migraine condition. But again, these have to have significantly worsened by the injury within the 7-day period. Most traumatic headaches can be thought of as being either migraine-like headaches or tension-like headaches. It's too complex to get into how these are diagnosed today. Cervicogenic headaches come from injury to the soft and/or hard tissues of the neck. These in turn refer pain up into the skull. This type of headache usually has the following characteristics. Like traumatic headaches, these must come on within 7 days of neck trauma. Pain most often starts in the neck and the shoulders, and there it radiates up the back of the head and further sometimes. Certain postures and/or movements of the neck can worsen it. Nausea with this headache type is rarely associated with it, unless the pain is severe. Right away, you can see that there is a big overlap between traumatic and cervicogenic headaches. What's more, concussion and neck injury go together. So, often you get both. That or some other headache type like a new migraine condition. Now I want to turn to the important and sometimes overlooked connection between headaches and whiplash. Here's a table that was prepared by some researchers. It shows how concussion and whiplash symptoms both overlap and differ. I mostly agree with this, but in my experience, patients with whiplash also often have sleep issues and increased irritability, and patients with concussions and post-concussion symptoms sometimes experience ringing in their ears. Take a minute now to look it over. Just a quick inspection shows you that concussions and whiplash have a lot in common and so can be confused one for the other. One of the problems is that the neck is frequently overlooked altogether by inexperienced MDs and even some PTs. They assume that the symptoms come from the concussion. I like to tell my patients that concussions and neck injury are like evil stepsisters. The two of them love to go to the ball and at very least cause Cinderella a headache. In reality, it's tough to tease apart where a given headache is coming from. In fact, I really don't bother trying to find out who's on first anymore. Instead, from the get-go, I find that treating both is often the best policy. The truth is that the diagnosis of concussion-related headaches can be quite complex. So, if despite you and your PT's best efforts, your headaches continue to linger, are moderate in severity, and significantly impacting the quality of your life, you absolutely should consult your GP or PMC. Hopefully they will then refer you on to a headache specialist, likely a neurologist, and preferably one who's in a clinic specializing in headaches. Well, that's all for today. In the next PT tip in this series, I will cover what you can do about your headache, plus or minus professional help. Keep on healing, August 14th, 2025.